for penetration, and 80% with open, and actually higher complication rate with robotic. 86% have urinary problems, usually meaning leakage of urine. So surgery not only is inferior as far as producing successful outcome, but surgery has much higher complication rates in the sexual field and in the urinary field. Many men have been asking about proton beam, and we have data also, page 9 of our booklet, looking at proton beam. And if you look at the Gleason 8, 9, 10 data, this is page 9 of our booklet, proton beam has a 48% success rate, which means the majority of the men have relapse of their cancer just within 5 years after proton beam. Compared to us, our results are 46% higher. So dramatically better results than proton beam for all Gleason numbers, but in particular this patient, Gleason 8, 9, 10, they're 48%. We are 46% better avoiding radical surgery with good quality of life. We're going to stop for just a moment. This is Dr. Lederman from Radiosurgery New York. We're a cancer treatment center, freestanding private cancer treatment center. We take insurances, Medicare, Medicaid. We take your calls, not machines. We have doctors, not students. We're aiming to do the best we can to give you all the choices, and that's why our phone number is 212-CHOICES. We'll be back in just a moment.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accept it. Call Dr. Lederman at 212-CHOICES. 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super. In Manhattan at 38th and Broadway. Custom tailored treatment to hit the cancer. Call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman. 212-CHOICES.
WOR New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hi, it's Gil Lederman. We're back. We're taking your calls and talking about things that hopefully will allow you to have a better life, a healthier life. We have Diane on the line from New York. Good evening, Diane.
Yes. Hi, Dr. Lederman. How are you?
Fine, thank God.
Okay, great. I'd like to ask a question about a very odd situation. I was diagnosed with lung nodules, non-calcified lung nodules. And there's one of them in each different areas, different lobes. And I also have a COPD with that. I was a smoker, and I stopped 35 years ago. The problem is I have bone pain and elevated calcium. And because these nodules have not changed on a CT scan, and I have a leukocytosis, I cannot get a diagnosis of anything. So I'm not feeling well, and I was just wondering what your take on this might be.
Well, I think we've met before. You sound very familiar to me. So I think, isn't that correct? I've seen you in the past?
Yes, you have.
Yeah, so I know your case, and you need to come in and speak in person. You have a very complex situation. So just give us a call at 212-CHOICES. 212-246-4237, and we'll meet like we have met before. But in general, for people, just for general information, people that have COPD and lung nodules that are suspicious or proven to be cancer, We often treat people with COPD because surgery is very deforming. Surgery may make COPD worse. Surgery may take away lung function, which you critically need. And radiosurgery allows us to treat lung cancers in people with COPD very effectively. Again, our success rate, and this is based on many patients treated, is about 90%. We're going to talk about a woman later in the show that we treated more than a decade ago with almost the same thing, COPD, lung cancer, and she's cancer-free 12 years later. So I wish you well. God bless you. And come by, let's sit down and stay a while. We'll find out and get to the bottom of this.
Yes.
Thank you now. Good night. And in the good news department, we had a gentleman who we treated several years ago for head and neck cancer. He's a 50-year-old gentleman. He's from Iran. He's been in America for 30 years. He runs a pizza shop in Long Island. He is doing great. He had head and neck cancer, biopsy-proven squamous cancer. We treated him with focused beam treatment. He is cancer-free. He came for a new scan and physical exam, and he's completely cancer-free. So for him, he got treated without surgery, without the deforming surgery or radical neck dissection, and has done well and remains in remission, the good news department. Also, I want to talk to you about a scientific article, and this was published recently in JAMA, and it looked at people who had sigmoidoscopy. And the study was made to evaluate the incidence of cancer and the mortality of cancer in people who had sigmoidoscopy. So in Norway, sigmoidoscopy on a regular basis can reduce the incidence and the mortality significantly. Why does it remove or decrease the incidence? Well, it can find precancerous lesions, and therefore it can decrease mortality. It reduced mortality by about 75 to 80% in people that are 50 to 54 and 55 to 64 years of age. So if you don't want colonoscopy, but you're worried about having a colon cancer, most colon cancers are found in the distal part by the anus, the rectum, and the sigmoid, and that can be evaluated by sigmoidoscopy and proven now to reduce incidence and mortality of colon cancers. Just a moment ago, I spoke to you about the woman that we treated in 2002 with lung cancer. She actually came in, saw me this week. She is in the good news department. She had biopsy-proven lung cancer. She was treated with focused radiation, so we're able to aim the cancer treatment just at the cancer, not hurt the healthy lung. She was treated with non-invasive treatment, no chemo, no surgery. She is cancer-free 14 years later. So some people say, once you have cancer, you always have cancer. Not true. Many people, more than half the people in America, are treated with effective therapy and are cancer-free. This woman is cancer-free from lung cancer. And I know that's not the usual story you hear, but again, she was treated with non-invasive treatment, which we think was very effective, avoided surgery, didn't spread the cancer. She is cancer-free. And another patient in the good news department comes from Italy, was just here this week. And I have his original paperwork from 2003 in front of me. He had a PSA 14 prostate cancer. So if you look in the booklet under PSA 14, if he had gone to the most famous surgeon in New York City, and the data is here, the chance of being cancer-free there is 69%. It's on page 6 of our booklet, figure 7, and you're welcome to call for that or come in. Our office is right in the heart of Manhattan. 69% with surgery. Our results are 25% better, 86%. What does it mean? Well, there's about 250,000 men a year with prostate cancer. 25% better results means more than 60,000 lives saved. Huge number if the patients came to us rather than surgery. And we know they can not only avoid radical surgery, but have a better quality of life, better sexual function, better urinary function, and like this man, hopefully be cancer-free so many years later. This is now 11 and a half years since prostate cancer. And the same man was diagnosed 2.5 years ago with pancreas cancer in Italy. Well, after the good results he had with prostate cancer treated, he came to us for his pancreas cancer treatment. He was treated with radiosurgery, focused beam treatment, no surgery, no cutting, did superbly, and is cancer-free 2.5 years out from pancreas cancer. So he has done great. And again, most of our patients with pancreas cancers where we aimed the beam have done great. Dr. Gil Lederman has looked at that data and is publishing that data and presenting it at national and international meetings. There's a big movement right now, and many women are choosing to have double mastectomies, meaning remove both breasts, even if they only have a little cancer in one breast. Well, there's a study that was just published. It looked at 200,000 Californian women, and it actually found the 10-year survival rate shows no benefit from bilateral mastectomies. Now, some women choose it. Maybe they're hoping, praying that removing both breasts will somehow do something magical, mystical to them. But in fact, just removing the lump of cancer and giving radiation afterwards gives equal results, and most women, will keep both breasts and have equal or better results. So there actually is no data for most women. And again, every person is different, so we have to speak to each patient. But there's actually no data showing benefit for these bilateral or double mastectomies in women. I'm not talking about BRCA women. I'm talking about usual women who have one-side breast cancer. There's no data. So you may want to give us a call. And we're seeing many women who have lumps who have not been diagnosed, and they are kind of hiding or hoping those lumps are nothing. It's better to find out what they are. It can easily be diagnosed, usually by just sticking a little needle in under some anesthesia, under local anesthesia, numbing up the skin. You don't feel a thing, and you can figure out exactly what you have without worrying and hiding. And if you have a breast cancer, it's better to treat it earlier. Earlier means better results than waiting. So just give us a call in our office. Again, we take most insurances, Medicare, Medicaid. We have something called the Urgent Cancer Consultant, where we promise to see patients within 1 day if you wish. We'd rather work harder than you sit home and suffer and wonder what's going on. And there's a new article out for men, just published by Sitai, that shows that men who have had vasectomies have an increased risk for lethal prostate cancers. So we would, of course, suggest that most men be screened, be evaluated for prostate cancer. It's a disease that affects so many men. But men who have had vasectomies have about a 20% increased risk of prostate cancer and a 19% increased risk of prostate cancer death. So the data is there, and we like to work with data, not just strange beliefs. We like to work with data and present the data to you so you can know exactly what's going on, and you can see the references, and you can examine it yourself. My name is Dr. Lederman from Radiosurgery New York. We're a cancer treatment center, a private cancer treatment center in New York City. We take most insurances, Medicare, Medicaid. We work for you. We believe that you are the president of the United States of your body, not the drug companies, not the surgeons. No. You should know all the options. You should have the data. You should have the papers in your hand. And if you've never seen your reports, your pathology, or your CDs of your images, you will with us, and we'll give them to you, and you can go home and analyze it, and you can learn all the options, all the choices. And that's why our phone number is 212-CHOICES, 212-CHOICES, because we believe that you do have choices, and you are the president of the United States of your body. We're going to stop for just a moment. We're going to hear from some friends, some voices about the work we do, and then we'll be right back.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212